Bismillah ar-Rahman ar-Rahim. My name is Abdul Moneim Fawzy, Professor of the Obstetric and Gynecology in Alexandria University Hospital, Faculty of Medicine.
Okay, for the first question, what can doctors do to promote natural childbirth and to make normal uninterrupted birth a normal thing?
Doctors have a lot to do. Actually, as you heard in my lectures, we have a triad, a circle or triad, which leads to increase the incidence of cesarean section nowadays. One of them is the patient, and second is the interpretation of the examination, miss or overestimation of the interpretation of the diagnosis, ultrasound, clinical examination, and then doctors. Doctor, he can assure the patient. Doctor can educate the patient. Doctor can speak about the physiology of the normal labor with the patient. Doctor can encourage the patient, and he has to simplify the process of the labor. Doctor can easily give the information about labor. Doctors must be in the back of the patient and correct any wrong information that the patient have an idea about. Doctor must not rush to cesarean section. Doctor must interpretate and not overestimate the finding of the ultrasound oligohydramnios, for example, large size baby, for example, contracted pelvis. He must estimate as correct and not to exaggerate, and must be not in hurry. Doctor has a lot to do.
Okay, so after being more than about 2 decades in the field of ONG, so why do you feel there is a need for such a change?
Yes, actually, that's a very good question. Nowadays, in the era of the evidence-based, we change the practice for the more safety for the patients. For example, in the first stage of the labor, we omit nowadays enema. We omit nowadays pubic hair shaving. We let the patient to freely move as much as he can, and freely to intake fluids, to feel free to eat what she wants. No obligation to apply a routine cannula. No obligation to apply a routine intravenous fluid. Intermittent auscultation is better than to have a pill or CTG or some. Please leave the nature to do. Please lead to physiology. Don't limit the movement of the patient. No augmentation of the labor. No oxytocins. Leave the nature to do. No supine position. The patient not to be in a bed. She must freely move, freely eat, and she must be psychologically and physiologically assessed every now and then, especially psychologically, as psychic support to the lady during labor, shorten the labor, increase the satisfaction of the lady, leave the sympathy to the baby, decrease the incidence of cesarean section, and what is. In the second stage, no lysotomy position, the upright lateral position. Don't ask the patient to push down. She will have the urge to push down later on. No episiotomy. No fundal pressure at all. In the third stage, we give a physiological management of the third stage, and if the postpartum is evident, you have to give an active management of the third stage by giving an oxytocin after delivery of the anterior shoulder, and by doing a massage of the uterus, and to have a controlled cord retraction and early cord clamping. And you have to put the patient 1 to 2 hours after you finish the labor under your strict observation.
So how long would you think would take for this new system, not new system, for to be implemented?
The evidence-based to be implemented.
Yeah.
First, you have two problems. The older staff, the older to change their mind, they are accustomed to do like that, blah, 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 blah. So you have a lot to prove that this, what we do is not beneficial to the patient and even harmful. I think in 2004, I did a small study in Childbirth, observational study in the Childbirth Maternity University Hospital, and I give a real percentage of everything. And then I give a lecture to the young doctors, and then we follow up. Markedly, we are changed.
Okay, so finally, my last question is: what is your hope and messages for the doctors and society out there?
Hope. I would like message for the ladies. Please omit fear from labor. Labor is a physiological process. Have a creation of the God. Actually, the baby likes to pass through the vagina, as I said in the lectures. So, no fear from labor. As your mom delivered, as your grandmother delivered, and that is why you are coming to the life. So, labor is a physiological process. Secondly, we have to train the young doctors how to be patient, not to hurry out, not to run behind money.